Ken, what are the messages that you have aimed at putting across here at the German Hospital Association conference with regard to strategies in the U.S.?
Well, what I was trying to bring across was the strategies that we're taking at Sharp and in the U.S. around, more effectively engaging patients in their care, looking at getting involved with managing care, throughout the continuum in their daily lives, and staying in contact, and also leveraging technology to allow them better access to care. So we have a lot of work going on to work with patients on a more ongoing basis versus just the episodes of care, and that's really driven around our movement towards a value-based care model, where we're responsible for keeping people healthy versus just treating them when they're sick, and understanding how we leverage technology to try to drive that. So that was one of the main messages. The second was to talk a lot about how we see the use of analytics as key in healthcare now that we have a lot of data that's been digitized and captured, how we can leverage that data for better decision making, for more insights onto what might happen, to allow our caregivers to have the information they need to make decisions at the point of care versus looking at things retrospectively. Also to engage other data like genomics data that will allow us to personalize the care and design programs that's more suited directly for that individual, because we understand their makeup, how they might interact with certain medications, with certain treatment protocols, and that. And then the last area was to really talk about how we see technology's capability in expanding our access and growing our business through the use of telemedicine, e-visits, digital connections with patients, the ability to leverage specialists, and make better access to them for individuals without having to go there. So it gives us an opportunity to grow our population, our business, without having to add more providers, maybe more clinics, and then, I think the final thing was just we wanted to talk about the fact that our healthcare system in the U.S. is under tremendous change. We don't know exactly what's coming at us, but the consistent message is we have to do more with less. We're going to get less dollars to provide care. We're going to have to look at becoming more and more efficient. So I think that was one of the things that we picked up here is, in the visit to Frankfurt, was how they really do a good job of prioritizing, because they seem to have less resources than we have in the U.S. to do the things that they're doing, especially in the technology area.
So very much in concrete, then, what was the response on the German peer side?
I think the response was trying to see how that the leveraging of technology as kind of as an organizational asset and strategy could be applied. What's the response here? Trying to understand maybe the similarities where the things would apply directly, and then also kind of understanding in more depth, how we're doing things, what kind of challenges that we might be facing. So I think it's an opportunity to learn and see where it may apply, and if not directly, how maybe indirectly, how we're using technology for one thing might have an opportunity to leverage a similar technology for a little different purpose, but picking up on how it could go. So I think it was well received. I think it's always good to learn from other people. We always like to try to find something that we can bring back and apply in our own organization.
So have you found anything on this side here of the Atlantic that you would be taking back?
Yeah, I really appreciated what we saw when we visited the hospital in Frankfurt, and understanding their governance model, the prioritization, how they were making decisions, and the way in which they kind of narrowed their focus to do a few things that really make a difference. Also, there was some discussion about the way in which that they're working with the physicians to collectively do the right thing, and it's a challenge we all have. So there may be some lessons there. The final thing I thought was interesting was on the last presentation we had yesterday was talking about the partnerships that they were doing to leverage a managed service provider to provide not only their infrastructure services, but maybe their support services, and how they might form a stronger partnership. That's an opportunity we have. We've always tried to do everything ourselves, but maybe there's an opportunity to turn to some others and partner with them to drive a better process.